Dr. Iwach, at the Glaucoma 360 meeting this year, you presented basically a hodgepodge of things under the title of Glaucoma News and Views. Could you give an overview of what you presented?
Well, there's a lot of activity in our field right now. And so first of all, we started off talking about what are we doing? We talked about some of the diagnostic tests that we do, and I showed the frequency that we're doing a lot of imaging of the optic nerve. In fact, we're doing almost as much imaging of the optic nerve as visual fields. But one line that didn't show up on the graph was gonioscopy. And that I wanted to point out is that we should, and we always do look at gonioscopy. It doesn't always get billed, but there's a new reason to do that. And that is when there's trauma to the eye, you can do something called angle recession. You can get a hyphema. And there was a recent report indicating that some of the Nerf bullets that kids use can actually cause that damage. If it was I feel vindicated, I was the only dad in my neighborhood getting our kids to wear eye protection. And we talked about there are different types of Nerf guns, and Nerf guns are great because kids are so attached to electronics. In my neighborhood with the kids that my kids play with, this is one activity. I can get them out running and having some exercise, so it's all good.
Yeah.
You just have to wear safety glasses, pretty straightforward.
Yeah.
We also then talked about what our current prescription patterns are, what we're using. We talked about the important role of prostaglandin analogs, beta blockers, and maybe being used a little bit more than in the past. But we also talked about some drug shortages that we're dealing with, from dorzolamide and COSA. We were very fortunate to have Wiley Chambers in the room, and so he was also able to give us a little bit of insight. And the bottom line is the good news is very soon this will pass, and there are some other alternatives available, so we talked about that. We then shifted gears and talked about some other issues regarding surgery and some of the new trends and how some of the newer surgical devices are being utilized. We still have to rely on some of our standard techniques. And also we talked about some of the problems, even though they're newer devices, unfortunately nothing is without complication, and that we just need to be cautious as we look at new technologies to implement them, because there are various factors that can influence what we hear about a product and what's right for our patient. This type of meeting provides information. Studies provide means and averages. As professionals, our job is to treat the individual. We don't treat means or averages. And so hopefully today people have an overview that'll help them help their patients. And that's what Glaucoma 360 is all about.
Yeah. Let me ask you this. With the whole wide range of things, what's the take-home message? What single items should ophthalmologists take away from your talk?
In looking where we are with glaucoma, it's a great time to be helping patients with glaucoma. We have some new medications that are the one's already in our clinic, one that should be in the clinic in April, Ropressa. Now we have Vyzulta currently available. We have some new surgical alternatives for our patients. We have some new diagnostic alternatives. We talked about looking at OCTA. So this is a time you want to stay in touch. You want to stay current, because these developments will ultimately help our patients see better. And that's what we're here for.